Hi, my name is Mandy Reeves. Today we will be discussing the drug Epanova, currently marketed by the company AstraZeneca, FDA approved in May 2014, a category Class C drug. Legal category, prescribing depends state to state. The drug Epanova, actions intended for the adult population, not children, and our intended action peaks for hypertriglycerides. Examples of ingredients of Epanova, active and inactive. Primarily we'll focus on the active ingredients. Those are the omega-3s. Some examples of omega-3s that we find in our dietary needs each day are flax seeds, walnuts, pecans, olive oil, kidney beans, navy beans, winter squash, leafy greens, and salmon. The purpose of omega-3s are to balance hormones, reduce inflammation, regulate blood glucose, prevent blood clotting, and balance cholesterol and triglycerides, which today will be the primary purpose of our drug Epanova. Epanova comes in 1 gram polyunsaturated fatty red-brown gelatin capsules. These capsules are not to be crushed, attempted to be dissolved, chewed, only swallowed. The drug is often to target, in conjunction with diet, adults who have hypertriglycerides. Hypertriglycerides are often seen in adults with poorly controlled diabetes, obesity, and sedentary lifestyles. The focus in controlling hypertriglycerides is to prevent the development of coronary artery disease. Epanova is the third prescription omega-3 fatty acid product approved in the U.S. in conjunction with exercise, diet therapy, in treating hypertriglycerides. The dosage and packaging information comes in. Adult dosage is 2 to 4 grams prescribed once daily. There are no indications that the drug should be taken with food as opposed to on an empty stomach. The drug is not intended for the children of PEDS population, which is identified as children aged 12 and under. As with any drug, there are side effects. The most common side effects of the drug Epanova are diarrhea, nausea, abdominal pain and discomfort related to belching and or gas. In regards to abnormal lab results, we expect to see elevated results in ALT, AST, and LDL levels. With any drug, there are side effects. There are also effects that require us to seek medical attention immediately. Should an individual have any of the following, they should seek emergency medical attention: cough, difficulty swallowing, dizziness or lightheadedness, elevated heart rate, itching, hives, rash, puffiness around the eyelids, face, and or lips, a tightness in the chest unexplained, and or a sudden weakness and tiredness. As well, when considering taking Epanova, you should discuss your medical conditions with your healthcare professional. Certain conditions that we would want to look at would be diabetes, hypothyroidism, any problems with the liver and or pancreas, if you're pregnant, breastfeeding, taking over-the-counter medications, herbal supplements, and or vitamins. Medication interactions that are primarily to be focused on are beta blockers, thiazides, and estrogen components. Those may exacerbate the symptoms of hypertriglycerides. And in summary, do not stop your medication. Do not double doses. It is important to diet and exercise, follow up with your physician, and continue with routine lab work.
created using Powtoon.